Hello, and welcome to our webinar series showcasing the outstanding work of community agencies across New York State funded by the New York tax checkoff dollars to reduce mental health stigma. I'm David Minot, Executive Director of Mental Health News Education, publisher of Behavioral Health News and Autism Spectrum News. I'm honored to have the opportunity to highlight these impactful projects and share with you the details of this important stigma reduction work. This series of webinars aims to highlight the innovative efforts of 7 organizations funded by the New York State Office of Mental Health for Stigma Reduction Community Initiatives in 2022 and 2023. We'll learn how these agencies identified targeted audiences within their regions, tailored their engagement strategies, and chose their interventions to address specific types of stigma impacting their communities. Stigma remains a significant barrier, discouraging individuals from seeking mental health support and limiting opportunities for those experiencing these challenges. However, local community providers possess invaluable knowledge about the populations they serve, positioning them uniquely to develop the most effective anti-stigma interventions through tailored outreach, marketing, education, and contact-based efforts. Over the course of these 7 webinars, we'll dive deep into the real-world experiences of these agencies to explore their methodologies, the challenges they faced, and how they measured the impacts of their interventions. Their stories offer a wealth of insights for other organizations looking to implement successful stigma reduction initiatives in their communities. We will also examine the key elements essential to any stigma reduction project, including understanding the target audiences, defining engagement strategies, setting clear goals and deliverables, and developing mechanisms to evaluate both qualitative and quantitative outcomes. Ultimately, these webinars aim to stimulate broader interest and collaboration in the fight against mental health stigma and increase mental wellness across New York State and beyond. We will include contact information at the end and encourage you to reach out to today's speakers to discuss how you can replicate a similar project in your own community. By fostering community coalitions, we can amplify our collective efforts and drive meaningful change. Once again, thank you for joining us and enjoy today's presentation.
Hello, my name is Michelle Melendez. I'm the Behavioral Health Director of the Star Health Center here at SUNY Downstate Medical Center. Was also the project manager of the OMH-funded project that we created called Stop Mental Health Stigma.
Hi, Michelle. Hi, everybody. My name is Jose. My pronouns are he, his, and I am the media and marketing consultant for the STAR program, and I'm also part of this incredible project, Stop Mental Health Stigma. And Michelle?
To know a little bit more about the STAR program, we have a few words from our program director.
Hello and welcome. I'm Dr. Jack Dehovitz, and I am proud to introduce you to the Special Treatment and Research STAR program here at SUNY Downstate Health Sciences University, located in the heart of Brooklyn, New York. The STAR program has been a beacon of hope since 1991, providing integrated clinical, educational, research, and community service programs within SUNY Downstate's Department of Medicine and our second location at 1 Brooklyn Health, Brookdale University Hospital Medical Center. As you explore our website, you'll discover what sets us apart. We're not simply an academic medical center, rather we see ourselves as more than that. We're of course educators, training our next generation of healthcare professionals. We're care providers, dedicated to delivering quality care, and we're researchers advancing knowledge in our field. But most importantly, we're community servants, raising awareness about health challenges such as HIV, hepatitis C, substance use, and more right here in Brooklyn. Our mission goes beyond our clinic walls. We conduct outreach, provide education, and implement community-based interventions to improve the health of our entire borough. We're guided by the input of consumers and community members through our STAR Community Advisory Group, ensuring we remain responsive to the needs of those we serve. At the STAR Health Center, we aim to be your medical home, providing comprehensive coordinated care led by our team of state licensed professionals. We've got you covered from internal medicine to infectious diseases, adult to family care. And if you need a specialist, we'll refer you to an excellent provider and coordinate your care. We're committed to quality. Our Star Health Centers received awards from the New York State Department of Health and the Health Resources and Services Administration of the federal government. And we're proud to be designated as a Level 3 patient-centered medical home by the National Committee for Quality Assurance. But we don't rest on our laurels. We're always striving to do better, to be better teachers, caregivers, researchers, and community activists. We look forward to partnering with you to make Brooklyn healthier, and we welcome your suggestions for achieving this goal. Let's work together to ensure a healthier future for all. Remember, I'm healthy for me, you be healthy for you.
At STAR Program, we take social media to the next level. We understand it is fundamental to our community engagement strategy, so we've made these platforms the stars of STAR Program. Social media campaigns targeting HIV prevention and care, STD awareness, mental health stigma, and COVID-19. Dedicated websites available in English, Spanish, Russian, and Haitian Creole. Present on the most popular social media platforms with original content curated for our community. Broadcasting 2 television programs online, for our youth and by our youth, The Chat, and for healthy living, Star for Brooklyn. With a variety of year-round online programming offering a multitude of ways to personalize engagement. Production of multilingual original content to ensure maximum outreach. Branded traditional media and educational material available in multiple languages. Present in outreach community events and health fairs throughout the year. Our own Star branded Metro card available at stations throughout Brooklyn. We provide HIV, HCV, and STI testing with our portable HIV testing station. Our 2 health centers, SUNY Downstate and Brookdale, serve over 2,000 patients. Star Community Link keeps everyone up to date on events, policy, research, achievements, and other news twice a year. With 6 active websites for Star, Theo, New York State International Training and Research Program, Matt Waiver Training, Get On Prep, and Faster Than. Educational materials available in Spanish, French, Arabic, and Chinese and Haitian Creole. Star Program. Be healthy for you.
Our project was entitled Stop Mental Health Stigma. And through OMH funding, we were able to create a website that we've designed that provides various anti-stigma messaging, mental health information, hotline numbers, and links to resources.
Thank you so much, Michelle. Social media has transformed how we communicate, share information, and even shape our perception about critical issues such as mental health. Social media platforms, when utilized effectively, can serve as a powerful tool in combating the stigma associated with mental health. Our research indicates that the content shared on this platform can significantly influence people's attitudes toward mental health. Negative or stigmatizing content can reinforce harmful stereotypes, while positive and informative content can foster greater understanding and empathy. So we are really happy to start this project at mentalhealthstigma.com. And as part of our campaign, it was crucial for us to use online and offline methods to spread positive and empowering messages. We use very popular platforms like Facebook, Instagram, YouTube, and of course, our website is stopmentalhealthstigma.com. And to achieve this, our goal was to create various types of content, such as information posts, personal testimonials. We had a roundtable discussion that we'll talk more about in a few, interactive section, online quizzes, and many other things like posters, an amazing amount of resources that people can find in our website. And also our website is available in Creole, Spanish, and English. These content formats, we're looking to humanize mental health issues and all the challenges and misconceptions that exist around it. However, we must add also to acknowledge the challenge in social media platforms because exists a couple policies that prevent us directly targeting patients. And I'm sure most of us have encountered these things in today's fastly changing policies in social media may sometimes difficult, but to navigate this, we focus on creating content that appeals to a broader audience, and also we start diversifying these messages depending on the target population. We started with people, Black and Latino members of our community that were 18 years plus, and then we understand that we maybe could expand our universe to a younger population. That's why we had a round table with youth that we will be talking in a little. So by fostering this more inclusive and empathetic online community, we can indirectly reach out to those affected by mental health issues and encourage them to seek help without the fear of stigma. In addition, we collaborate with our staff, community members, and other organizations such as the Adolescent Education Program known as TIO, and here a division of a STAR program, which we have created an incredible roundtable with teams discussing stigma as well as mental health leaders from our community or a part of our organization on providing a message and expanding this way our audience. So utilizing these platforms and our partners' platform, they help us distribute as content, connect with their followers, and encourage meaningful discussion around mental health. So in conclusion, while the path eradicating mental health stigma is undeniably challenging, the potential of social media as a tool for change is immense. We found that these positive measures encourage people to participate, to embrace in a conversation. We have even staff sharing their story, testimonials that when they help us break also the gap between our providers and communication reserve, and also to help our youth to participate with the immense amount of incredible experience that this young folks has in facing the stigma in today's days in a digital era, where there's a lot of ways of being attacked in our mental health exist as well. So with software strategies and our persistent effort, we can harness the power to further our mission and make a lasting positive impact throughout the power of digital content, social media, and offline strategies. Our campaign, Stop Mental Health Stigma, successfully attracted a diverse range of users with a slightly higher proportion of males and a significant representation for our younger age group between 18 to 34. The users show active engagement with our website content, but most users find our site directly, while organic search, referrals, social media paid ads, and other channels also contribute user acquisition, like doing cross-promotion effort with other members of our community or the organizations like TIO and others who help share this message. The audience interest data provides useful insight into tailoring our future content and campaigns to align it with our audience preference and needs. That way we understand that fostering this positive message make a big difference. During this current period, in stopmentalhealthstigma.com, we attracted 35,531 users, resulting in 37,132 sessions. It sounds weird, but that means that our site recorded 51,471 views, which means that some people came more than one time to our site. And the way that we able to track this is like we did it either for IP or for device that was used, so we know exactly that it's not repetitive from the same person, and we can tell it's the same person actually visited our site. Obviously, always taking care the privacy and all the compliance that are necessary in these cases. Our audience response providing a valuable insight into the attitudes toward mental health, illness, and stigma, helping us shape our campaign accordingly. The majority of our responders express the need of love and support for people with mental health, while some misconceptions about stigma were identified and addressed. The finding also highlighted the importance of listening and supporting family members with mental health, suffering with mental health. So moving forward, we utilize these insights to refine further and create strategies, initiatives in reducing mental health stigma. And that's why we decide, for example, creating the roundtables, involve younger audiences to create a population that also we need to involve our youth. At the beginning, we just started with 18 plus, and we understand that fostering that. And we also had incredible amount of participants that were 50 plus. So that means that we were able to foster an incredible amount and a broad audience. But at the beginning, we had to face those problems of trying to use targeted advertising when we were denied by the policies of Meta, which is Facebook, Instagram, and we had to adapt to find the best way of complying, also in Google, to be able to target and to correctly send a message that embrace stigma and mental health and relates to others by adapting to the fastest changing policies online. So we're grateful for all the participants and the contribution, and definitely we're looking forward to continuing our work. We're creating more content also in Spanish, and hopefully we can stand. So when we talk about understanding stigma in our website or our campaign, almost 67% of our participants incorrectly saw that stigma is not a problem for people with mental health condition. By that, we can say that 16.7% of our people who participated recognize that stigma makes people feel alienated or less than on others. By other 16.7% understood that it prevents them from seeking help or understanding their symptoms. So all the responders agree that stigma make people feel judgment in their in sharing their story. And that's why we encourage people to participate by having testimonial, members of our community, youth, of people from all ages, and content that relates to different lifestyles, and especially to the community we serve in the surrounding areas of the STAR program in the Health and Science University at SUNY Downstate here in Brooklyn. When we talk about family support and what we found in this grant, it was that 83.3% of the respondents believe that is someone in their family is diagnosed with a mental illness. They should listen to them and show support. None of these participants show options like threatening them differently, distance themselves, or feeling sorry for them, which I think is an incredible improvement where we can see how the effort that all of us at different programs we've done throughout the years or OMH is having a good impact on what we've seen in the past. Our demographic, the majority of responders fell into the participating in quizzes were into the age of 55 to 64 age group in the website. But we had a great amount of people who participated in Instagram or Facebook that were younger population that we mentioned before. The other age group had not so many responses when it comes to quiz or when we had this feature of pledging to end stigma. But of those, we learned incredible amount of data on how to identify why those people were not responding. That's when we start creating content that related to these different audiences. Our gender were 83 identify as female, while 16% identify as a male. We had a lot amount of female, which is interesting. And none of our participants identify as non-binary, prefer to self-identify, or prefer to not disclose their gender. So here at StopMentalHealthStigma.com and STAR program, we are excited to work in this program. And with the help of Michelle Melendez and other teams of our staff, and also we went ahead and we have other clinics in other locations like Brookdale Hospital or One Brookdale, where our staff, members of our staff, they're participating in content, sharing their stories, associating with other organizations, like we said, that are division of STAR program, like the adolescent program as DIO. We were able to foster this sense of community. Michelle also were able to create some activities that we were doing with our staff. For example, about suiciding, how to address mental health in the workplace, and many other incredible activities that I will pass the floor to Michelle Melendez so she can speak a little bit more about it.
Before we established the project fully, we did do some research that included focus groups, interviews with staff, as well as consulting with our consumer advisory group. Through these discussions, we developed some activities that included a training on suicide prevention. We also did activity for Mental Health Awareness Month. There was some also awareness and information given around how to foster healthy coping strategies in the workplace as part of workplace mental health. We also did a focus group with high schoolers and early college students about their experience with mental health stigma as it pertains to their age group. And obviously there were some differences there as opposed to mental health stigma as it relates to like older population. So speaking with the younger population, again, of high schools and early college students, we learned a lot about what their experiences with mental health stigma and also how their culture also impacts stigma, particularly among the African American and Caribbean populations. We learned a lot about how some cultural understandings around what it means to have a mental health diagnosis and what it means to get treatment sometimes could increase stigma around those populations. Drawing from our own experience developing the mental health stigma campaign on our website, some of the recommendations that we would have for any other programs that are interested in developing their own website or Stop Mental Health Stigma campaign is to definitely get your patients involved. Speak to your patients, let them tell their stories and their experience, and also to share with you what they think are some of the ways that we even as providers can contribute to the reduction of mental health stigma. Also speak to your staff as well. Encourage people to share their own personal stories, to share their ideas on ways to reduce mental health stigma. And I think gathering that information again from staff and patients, even perhaps other community members that perhaps maybe collaborate with your program, collecting all of that information, I think would be really important in shaping your Stop Mental Health Stigma campaign.
Thank you, Michelle. And also it's important to utilize all the incredible resources that we have online. Meta Business, or in this case, will be known by you by Facebook, Instagram. They have an incredible platform that has offered you incredible amount of resources, of insights, data to better understand that audience that you're reaching. Or also, sometimes no information is good information. Which audience we are not receiving our message. We also partner with other vendors, for example, like Marketing 360 and Wire, which help us distribute our ads and foster more amount of data. We created our website in a platform called Wix, which allow us to be adaptive to any type of device or desktop device which help us obviously deliver the message well. But what is important here is to understand not just those numbers, is to meet people where people are. And when we talk about mental health, as Michelle was saying, it's so important to be inclusive, to involve to create an inner community within our organizations, and from there grow out to the community that we serve. It's truly important that we understand from inside out. When we start from home, things get better. And that's something that we're doing with the different activities. If you have a campaign and it's not supported by the offline world, digital is amazing. And yes, we all know that online, a lot of people every day, we all are connected to our devices. In fact, that's why we use a lot of video. It is known by research and that 85%, 90% actually, the content that we digest every day comes in the form of a video in a mobile device. But 88% of the content that we retain, it comes in that form. By 50% of that content that we retain, it comes just in a visual image. So we consider that using all this type of tools that we have, with our partner Market 360 and McGuire, which allow us to expand the universe of the ads distribution and to basically take those goals that we had when at the beginning we're trying to do advertising and they were not being approved by Meta or YouTube, or in this case, YouTube was easier because you can force the message in this way. But social media, it's those organizations try to obviously protect themselves more, and it's so difficult to be more specific niche. But there's so many tools by lifestyle, by age groups, or in this case, we use this incredible tool that I will invite you to use, which is called geofencing. Geofencing is basically will help you go to those demographics, zip code areas where we know where those patients are in need, and when we identify those areas that where we want to help, or probably because any type of research data that we have, we know that these specific areas might need, even though we know that everybody can benefit from mental health, it allows you to first have a better use of the possibly marketing dollars that you have in order to spread the message, PSAs, and utilize other tools that we have. For example, our system, our programming, our website allows to have the site in Spanish, in Creole, and also in English, and we created other interactive pieces that we can share. For example, we use the story of Camila Mendez or Naomi Osaka, which is a famous tennis player, or Derry McDaniels. We got the stories of people who are popular or they're famous, and they're very open about their mental health to try to break those gaps. So the tools are there for you to use, and invite other organizations and members have to participate. If you have joint venture or you have other community partners, it is always important to join forces, because at the end, our ultimate goal is the same, is to spread the message of ending the stigma and to normalize mental health and allow people to get the sick and seek the help that they rightfully deserve. So now I'm gonna go to the fun part. I'm gonna share my screen here, and I'm gonna take you guys a little so you can see or visit with us our website. So this is stopmentalhealthstigma.com. So right now we see it, our website is in Spanish, so I'm just gonna go back and take it to English. There you go. And our website has a lot of fun stuff here. For example,
to the Stop Mental Health Stigma Roundtables, proudly presented by the STAR program, a project generously funded by the New York State Office of Mental Health.
Good afternoon. My name is Michelle Melendez. I'm the Behavioral Health Director of the STAR Health Center here at SUNY Downstate. Thank you to the Theo team that is here today, that are here to address mental health stigma among youth, just concerns that young people may have.
Yes, I think there are enough resources, but it's actually tying back to that social media bit. I don't think we're using our channels correctly. So instead of, one thing that we're learning is access to healthcare, access to mental health, and knowing how to navigate the system. A lot of the problem that us as young people have is not knowing where to go, who to go to. And it could be someone that's not as simple, but someone as close to you as your guidance counselor at school. It doesn't have to be always a therapist that you go speak to or were referred to. And we also use social media to promote our things. So why can't we use social media to promote mental health and well-being?
Okay, this poem is entitled Unsinkable, and it's from my poetry book, Rocky Road Survivors. Unbreakable, I will not be submerged by pain. Unbreakable, greatness embedded in my name. Like bamboo, I bend, but I don't snap. Since childhood, I endured wounds of life. Saw my mom cry, asked why, I pressed nevertheless. Wiped my tears and persevered past the strife. Like paper, when I was torn, I cut those who touched. The hurt in me seeped out in various forms. I was a shelter for the broken and extended myself, but had nowhere to run from my personal storms. I gave in spite of my needs, putting others before me.
And recovery is possible. Unlike other areas of our health care, many people don't have an affordable or accessible routine care plan for mental health challenges. Individuals who may have access often suffer in silence due to the stigma of being diagnosed.
Acabemos con el estigma de la salud mental. Hoy en día, el estrés, la ansiedad y la depresión forman parte de nuestra vida cotidiana más que nunca. Sin embargo, hay muchos de nosotros que nos sentimos avergonzados para hablar sobre nuestra salud mental. Yo fui uno de ellos. Por eso quiero compartir contigo lo poderoso que es luchar para terminar con cualquier tipo de estigma.
Let's talk about 7 things you can do to reduce mental health stigma and make our society more inclusive for everyone. Let's start by committing to being mindful of language when talking about mental illness. Let's choose words that are both empathetic and accurate, such as illness, condition, or disorder, instead of words like crazy or insane. The second step is actively listening when someone chooses to open up about their mental health issues, showing them your full attention, offering understanding without judgment, and providing emotional support whenever needed.
Pledge to end stigma with us and help create a new dialogue about mental health. STAR program. Be healthy for you.
So I would say, get educated, find information about mental health, and you can get some of that information on our website.
We can find places like how to get involved or how to stop mental health stigma at the workplace, how to help parents, patient stories, and many others. And we complement this with having Facebook, Instagram, YouTube, and spread it throughout the different pages that we have. Also sharing this content with other organizations like obviously TIO or the hospital itself and Downstate. And that way we were able to, besides the ads that were complementary to this content that you guys see on the website or the quizzes that we say here, let's see, here's one of the quizzes. And people can add, or people can just go and go to our take the pledge to end stigma. And that way we start getting all that data. For that, we use some APIs or Pixel, which basically is a programming embedded into our website to better capture all the movement of the people who are coming and allowing to get the specific information that we wanted. For example, zip code, gender, age group, and how long did they stay, and what did they click, and what type of participation they had, so we better comprehend the type of engagement that the users were having in our website. We also had here we don't have events currently, but let's go. We also share all the resources like posters, and other social media ads that people can share in their Instagram or in their social profiles, which was fun to see. That it was great to see how other people actually participated. We have a national mental health awareness observances in our website as well. Well, thank you so much for spending some time with us here. The STAR program campaign, Stop Mental Health Stigma, funded by OMH. Michelle and I, and here we're all a STAR. We are happy to help you and share information, and happy to have a conversation where we all can share this incredible work that we all put in to help our community, to help ourselves, and to help people that we love in this beautiful community of New York. Thank you.
Thank you.